Now, for more on this, let's bring in Stephen Camarota, Director of Research for the Center for Immigration Studies, a Washington, D.C.-based research institute that examines the consequences of legal and illegal immigration on the United States. Stephen, thanks so much for joining us today. We really appreciate it. So tell us, how significant is this new rule from the Department of Health and Human Services, and who exactly makes up DACA?
Right. So to remind your listeners, DACA individuals are those who are brought to the United States at young ages, and then they're all now adults. But the Obama administration then passed a rule or had a policy that they wouldn't deport them. They were granted what's called deferred action, including work authorization, social security number, and things like that. But they don't technically have legal status. They're still considered illegal immigrants or illegal aliens or undocumented. So they are residing here, and we're not going to deport them, but they don't actually have legal status either. Now, that the DACA status could be withdrawn conceivably as well. So that's the group of individuals. Again, they're all adults, even though they came as children generally.
Yeah, and as we heard from Owen Jensen, this new move is expected to help about 100,000 people. Can you talk to us, exactly how it is going to benefit them, and give us an example of how or why they wouldn't be able to get coverage maybe through their work, Medicaid, or even ObamaCare previously?
Right. So we think there may be about 600,000 DACA recipients right now. There used to be more, but there's an attrition out of that population. People go home, get married, that sort of thing. And so many of those people already have insurance through their employer, or they bought it on their own. And that's it. If you don't have an employer who's offering, or you're not working, now these are mostly working age people, but if you're not working, you can't get it through a spouse, what have you, then you have to go on one of the exchanges, right, and try to buy insurance, typically, through the ObamaCare system. And so part of the Affordable Care Act is that if you don't have a lot of money, then they will subsidize that private health care, sometimes quite a lot. The average subsidy per year that people get per person is about $5,000. So if the insurance would have cost you $7,000, you get a $5,000 subsidy, say, and then you only have to pay $2,000. Sometimes they're called affordability credits or subsidy credits. But the bottom line is that's what they're now eligible. And we think based on income and the fraction that don't have health insurance, the educated guess is around 100,000 people who will now don't necessarily have health care, but they will at least be able to buy it at a much lower price due to the subsidies, though it's important to note that the money is coming from taxpayers to subsidize their health insurance.
Now, Stephen, so much we can talk about, but we're out of time. Thank you so much for coming on and sorting this all out. We appreciate it.
Thanks for having me.